And the news tonight, in this summer of 2021, is starting to look a lot like last summer, if you look around and pay attention. It's looking like other periods where America has been battling this rising COVID problem, even when there are available solutions to curb it. COVID is surging today among the unvaccinated.
This pandemic is spiraling out of control yet again. And it's spiraling out of control because we don't have enough people vaccinated. There's also real harm to you because guess what? More mitigation is coming, whether it's masking or whether it's closures or whether it's your kids having to return to virtual learning. That is coming.
The U.S. daily case count has more than doubled to 50,000. And people who need hospital care, a sign that they're in a bad COVID situation, has surged up 58% over the last 2 weeks alone. These are numbers you need to know. The hardest hit places are often areas with anti-COVID politics, misinformation problems, and low vaccination. 1 in 5 of the new cases are in Florida. Alabama, hurting. With only about 1 out of 3 people vaccinated there, the number of people going to the hospital in Alabama has more than tripled just this month. And like so many other polarized issues, we are seeing emerging a story of 2 pandemics in America during this period of an available vaccine. We have the places with the higher vaccine rates that are doing better, and they're increasingly quicker to issue even onerous rules for a largely vaccinated population. New York City and L.A. will now require vaccines for their city's rather large workforce. The VA, federally, is mandating vaccines for their medical workers. That's the first federal agency to do so. Now, and overall, just over half the country has at least 1 dose. Dr. Fauci continuing to stress that low vaccination rates are courting a deepening COVID relapse.
You're probably going to have like 100 million people who are not vaccinated. With that many unvaccinated people going into the fall with the Delta variant as efficient as it is in transmitting, we could have a really serious problem with a considerable surge of infections.
This is not a drill. Everyone can make their own choices about their health. But many people are trying to make these choices in a framework of misinformation or outright lies. Caregivers note that social media and the media seem to be the main causes driving people to hold out on the vaccine. Some health officials are blatantly pleading with outlets like Fox News to provide more accurate information so their vaccine-hesitant viewers may not be led away from a potentially life-saving option. Now, I began this report for you just a few minutes ago, noting how surging COVID can feel like an echo of last summer, or moments we've all lived together recently. But the main difference is as obvious as it is tragic. This time, unlike last summer, there is a scientifically sound, widely tested antidote to COVID, a vaccine that's widely available in this comparatively rich nation that we all live in here. But experts say, whatever the wealth that allows vaccines to be so widely available here, something that many other parts of the world would crave to get, the experts say we are still poor when it comes to scientific literacy, which leads many to reject the one thing that could save them.
It's a little like being on the Titanic and offering people lifeboats and having them, repeatedly turn you down.
I'm joined now by Dr. Kavita Patel, former Obama health advisor with Brookings, and Juanita Tolliver, an MSNBC analyst. Doctor, it is getting worse, and we're seeing more and more of the public health energy being put towards public health messaging.
Yeah, Ari, it's unfortunate, but as you showed in some of the clips, I mean, we're trying to stave off those very blunt kind of policy, staying at home, restrictions around attendance, indoor gatherings, and of course this kind of mask mandate. But that's where we are, and we're looking to other countries to try to seek out, where are we in this? Are we weeks away from peaking? The truth, Ari, is that we just don't know because it's a moving calculus. We've got a variant with a population that has kind of wide varieties of vaccine timetables, people who were vaccinated as early as December of last year, and that might have waning immunity. That's why the issue of a booster shot becomes relevant, to people who are getting vaccinated for the first time today. So this is something that, you're right, it does feel like deja vu to sit here and talk about surges in hospitals and workforce shortages. But as you point out, we actually have essentially as close to a cure as possible in the form of a vaccine. The messaging is complicated. You're seeing many of us kind of turn against each other pro-mask mandate, anti-mask mandate. I'll just put it here. I'm pro-vaccine, and anything we can do short of that is mitigation, because we just have too many people who are unvaccinated.
Yeah, and, it doesn't have to be this way. Sometimes we think about these things and we say, well, they're intractable debates, and there are certainly areas of health or long-term planning where you have these trade-offs. But we're actually coming in very nearly last when it comes to having just a basic scientific understanding of the vaccine, which I say is distinct from someone with the right facts and information deciding they don't want it. Okay. But if you have the wrong facts, well, everything after that is sort of garbage in, garbage out. The Times has an extensive report on this today. I want to read from the Delta variant. They note is a bigger of a symptom, I should say, of a bigger threat, which is the vaccine refusal. Were a wider swath of the population vaccinated, there would be no resurgence right now of the Delta variant or the Alpha variant or any other version of the coronavirus, the Times says in this report. And this is what I want to ask you about. Quote, America is one of the few countries with enough vaccines at its disposal to protect every resident. And yet it has one of the highest rates of vaccine hesitance or refusal of any nation, doctor, except Russia. What gives?
Yeah, well, Ari, I think what gives is that we have, it's actually the same thing that has plagued us when we have people who still believe that Donald Trump is the actual president. We have people who still believe that January 6th was actually not a terrorist event. People who still believe that 9/11 was a conspiracy. So there's unfortunately, people want this to have started with the coronavirus. It's been starting for decades. Ari, those of us in healthcare have seen this when we saw entire pockets of neighborhoods in the country who refused the measles vaccine for their children and started to propagate through social media, mainly, kind of this myth about the association of those vaccines and long-term health outcomes. So we've been fighting this fight for decades. I think now we're all kind of feeling it in our forefront because it's affecting literally every person on this planet. I will add, though, that I'm starting to see data coming out of other countries, and they're seeing what Americans are doing, Ari. We're actually kind of spreading our poor behaviors because even countries that don't have access to the vaccines that we do are looking, and they're saying, well, if the Americans are not taking it, well, why should we take it? That is absolutely the worst thing that could happen when we actually now can offer, in the next, hopefully 6 to 12 months, vaccines to everyone on the planet.
Yeah, I mean, Juanita, that goes right to the heart of it, which is, COVID is contagious, but so apparently is ignorance and stupidity. And when I talk about, for example, people who consume other media, I'm talking about them as citizens. They may not be predominantly our viewers as a media matter, but I'm thinking a little bigger than that, thinking about their well-being and safety. And so if you look at, for example, this poll regarding Fox News viewers, and percent vaccinated. Again, this is a little meta, but I think it's sort of interesting. You could see there at the bottom of this chart here, it's 62%. And it goes up to network news there is around 79, and MSNBC, CNN, 83%. And so one of the reasons we show this is not just to talk about the press, Juanita, but to talk about the actual public health reality that whether it's chicken or egg, there are people who either are consuming a certain type of information or are drawn to it because of their pre-held beliefs. But either way, Juanita, they're not coming up with a factual framework and then saying pass, which is fine, because, again, I think people have their own rights. But studies show they're misinformed. They don't understand how safe this is, and thus they're putting themselves and their families at risk.
That's exactly right, Ari. And what I appreciate also about the chart and the numbers you just showed was even compared to a different time period 6 weeks ago, Fox News has held stagnant at the low 60s, whereas other networks have jumped up by 5 and 9 points each. And so what's frustrating here is that when we see that clip circulating of Hannity last week and everybody's applauding this, I'm like, no, Fox News needs to dedicate the same amount of time and energy they dedicated to spreading lies and misinformation over the past 19 months in order to put a dent in the harm that they've caused, while hundreds and hundreds of thousands of people have been consuming that media, choosing not to get vaccinated, choosing not to protect themselves. And so the only way for this to balance out is to get this misinformation under control. And you're right, that does extend to social media, because that's what we're seeing on the ground. That is a reason why people are not getting vaccinated. They see one chart, they see one quote, and they run with it. They hold on to it like a vice grip because it affirms whatever they're already feeling. It affirms whatever they're already fearing. And so they stick to that at what cost, though, Ari? At the cost of their life, potentially, as we're saying this Delta variant spread. And so I completely agree with you. This should not be a political matter. This should be about facts. This should be about science. But with the regular spread and the stream of disinformation over 18 months, 19 months since the start of this pandemic, that has eroded trust, not only in science, but also in government. And that's why you have people holding out on this vaccine right now.